Well, mental health issues are on the rise here in America. Some people go undiagnosed and untreated because they don't want to visit a mental health professional. Now, an influential health panel recommends primary care physicians begin screening for anxiety and depression. CBN medical reporter Lorie explains.
Cases of anxiety and depression jumped significantly during the COVID pandemic. This increase could be a reason the U.S. Preventive Services Task Force decided recently to recommend primary care providers begin screening patients for anxiety disorders. This follows an earlier recommendation to also screen for possible depression. In the U.S., an estimated 40% of adults report symptoms of anxiety, a disproportionate and constant fear over everyday events, depression, persistent feelings of sadness or a lack of interest in everyday activities, or both.
When a patient comes into our office, there's a lot of times they don't know that their symptoms are related to depression and anxiety.
Since primary care providers are often the first line of defense for a patient's physical needs, they're seen as an important resource for mental health issues as well.
It would be great if patients knew that they could bring up their concerns with us in the office, as primary care providers. But it is also my responsibility to do depression and anxiety screening on them.
Anxiety screenings usually involve asking the patient to rate the frequency and severity of feelings like nervousness, restlessness, and fear. Depression screenings center on things like sadness, hopelessness, and thoughts of hurting yourself.
Michelle made me feel very comfortable talking to her about my mental health.
Primary care providers can refer patients for therapy, prescribe medication, or both. Given the dozens of antidepressants and anti-anxiety drugs available, finding the right treatment can involve a bit of trial and error. That's why some healthcare professionals use DNA testing to streamline the process. It can show which medications work best for other patients with similar genetic profiles.
It's a really important tool for them to use when they're thinking about what treatment protocols or how do I want to treat this patient, not only with which drugs that they want to pick, but also how they dose these specific drugs.
So while many people suffering from anxiety or depression reach out to counselors, psychologists, and psychiatrists, those aren't the only ones who can help. Sometimes a visit to a trusted primary care provider may be just as effective.
So far it has been great. I feel a lot more myself. I enjoy things that I used to enjoy before.
Lorie, CBN News.